Hi everybody, and welcome to today's Florida Hospital Health Chat. I'm Jennifer Roberts, and today's topic is taking off running. We're going to have some tips for all levels of runners. As you know, it's getting into race season. We're going to talk some more about that as well. We have two guests today. First of all, we're going to talk with Betsy Hughes. She's the co-owner of the Track Shack, and we can find out more about that in just a minute. Later on in this short web chat, we're going to bring in an athletics trainer here from Florida Hospital, David Cassidy, as well. So Betsy, thank you so much for joining us here today. We're going to talk about veteran runners and beginning running, kind of cover the bases for everybody, and we're trying to make sure people are running in a healthy way. That's really the most important part. You want to get all the health benefits out of running. And of course, this is not just us talking. We would love to hear from people that are watching us today. So please feel free to submit your question, and we'll try and get some of those answered here for you today. So we've got a special Track Shack offer, a little tease for that. So we're going to talk about that in a few minutes. If you're into running, you definitely want to stick around for that part. So let's get things started and get on to the information. Betsy, again, thank you so much for joining us and representing Track Shack here today.
Thanks for having me.
Absolutely. You know, whether you're new to running or not, training is one of those parts of running a marathon or even a shorter race than that is really the focus of what you're doing. What are some of the things that are most important to do to prepare for a race?
Well, before you prepare for a race, you've got to do your training. So before we do our training, we have to be fit properly for a pair of running shoes. And that's sort of our big goal at Track Shack, is to keep our runners healthy. So when runners come into the store or walkers come in, we do an evaluation. We figure out their needs in terms of support. We ask them a lot of questions. What are some of their goals? Are they running a marathon or a 5K? We measure their feet. We get them all set up in the right shoe. And then we talk to them about our training programs and get them ready to do the event that they're hoping to do.
You brought some supplies here for us. Tell us, you talked about running shoes. Tell us what are the important facets of a running shoe, and why is that just so important? I mean, running's your instrument in this, your feet are your instrument here.
Right. Well, our wall at Track Shack is so big. It's full of probably 150 shoes.
Wow.
So every foot that comes in the door is a little bit different. That's why it's so important that we take that time to fit the runner or the walker in the right shoe. And a running shoe has many components, and every shoe on our wall is a little different. So once we figure out what they need, we're able to show them several styles, watch them run or walk, and get them going. We also do something that's a little different. We teach our runners and walkers how to put their shoes on properly.
Really?
And it sounds so simple and elementary, but it really makes a difference to put it on right, to tie it right. Not too tight, just snug. We don't want heel slippage. We also talk about socks. Moisture wicking socks come in thick sizes. They come thin. It just depends on the customer's foot. So we do a lot of chatting with all our customers before we really get them going.
So if you decide, okay, now is the time, I want to take up running, I want to give it a shot, how do you pick a race when you do to start that training and set that goal? What do you advise people to do?
I think for a lot of folks, it depends on if they want to stay local. We have a website with the largest regional calendar of throughout the state of anyone, and you pick and choose. If it's a 5K, you've got probably 4 or 5Ks to choose from every single weekend. So if you don't want to travel far, there's probably one right in your hometown. We have a calendar listing on our Start Line guide that goes out to our customers. Florida Hospital is a wonderful partner and helps us produce and sponsor many events in town.
Great, great. Talk about some of the things. When do you start training for that race? So when you say you've decided to start for a 5K, if that's going to be your first thing you're going to do. When do you need to start practicing? You can't just show up for the 5K and say, okay, I'm ready to go.
No, that's very true. We encourage our newbies, we call them, to really start a little walking program before they start running. And then we encourage interval running and walking. And to do a 5K, which is 3.1 miles, we really think it's a good 3-month process before you start with a full 3 miles. It's very important to get your legs and your feet ready and used to all the impact. That's why the shoes, again, are so important. And they have to commit to training 3 to 4 times a week. It's not an everyday situation, so it's not too overwhelming for most people. But 3 or 4 times a week to walk and run and build up that gradually, maybe over a 3-month period, a 6 or 12-week plan.
And if someone wants to start bigger than the 5K for the first race, if you're going to a half marathon and that's going to be your goal, then you got to back that time up significantly.
Absolutely, absolutely. A half marathon, I would say a minimum of 6 months. You'd be smarter to wait a year.
Wow.
It takes a toll on your body. And our folks in our training programs, they usually use at least 6 months for that first half marathon. And then once they get that half under their belt, another 6 months to do a marathon.
Wow. So talk a bit about what people should do. Let's say we've done our training, we get up to race day. What are some of the things people need to remember when they arrive there for the race?
Race day is really important, and you want to treat it very much like your regular running days, which means before you race, you need to break your fast. Most races are in the morning, so it's very important to hydrate, but also to break your fast with either a piece of toast, a banana, oatmeal, or some of the energy food products that we have at Track Shack. They're complex carbs, so they digest easily, and it's important to do that an hour to half an hour before your race. And of course, you want to make sure you have your race number and your timing device, which is typically on your race number, so you don't have to think too hard. You're going to safety pin your number onto the front of your shirt, and you're all set to go when the gun goes off.
Great. What are some of the proper things you should prep for? I know there are some products and things that you were going to talk about for the day of the race and then after the race as well.
Right. Well, obviously you need your socks and your shoes. We are big proponents of an anti-chafing cream called Body Glide. This is good for your toes. It's good for anywhere you have chafing. For ladies, it's great for the bra line. Tends to be a typical chafing area, especially in Florida with our humidity. We have great timing devices. We have watches that actually can not just be a stopwatch, but also can beep or vibrate when it's time to take walking breaks if you're training that way.
Okay.
So race day, of course, you want to bring something to change into after the race because you'll be so hot and sweaty. And we also are proponents with our longer events of recovery socks or sleeves. Not necessarily to run in, but certainly to wear after the race, especially if you're traveling long distances.
Okay.
And then one of our favorite tools in the world is a foam roller.
Okay, tell us about that. That's what this is, right?
It is. This is a very tiny foam roller. They come in all shapes and sizes, but typically they are tube size. They are good for sitting on to stretch out your hamstrings. They are good for your ITs, for your calves. It becomes a runner's best friend.
Okay, very good. So we teased a little bit out at the beginning of all this that there was going to be a special deal for viewers today, a special deal from Track Shack. So Betsy has graciously offered to give folks that are watching 10% off of your next purchase at Track Shack. Gotta ask for that though by November 30th, right? November 30th. Okay, and this is just in time for race season. This is when everybody's gearing up here in Florida. Everybody wants to run when it's cool outside.
That's right. Well, it's time for the holidays, so why not start running and walking now? We have lots of fun holiday events. Plus, it's a great way to keep your weight down as you start
eating a little bit more? Yeah, we've heard that one too. So what you can do is use the email address that you're going to see on the screen here to take advantage of that offer, and you're going to see that a couple of times throughout the rest of this web chat. We're going to put it up there several times for you. So certainly take advantage of that, and we want to for sure thank Betsy for joining us today. I want to make sure, I think we have a question coming in on the website here. Let's just take a look. And Betsy, before I let you go, what things do you look at to help find the right shoe? So maybe if you don't have all the guidance that you guys offer at Track Shack, if you're going somewhere else, what should you do personally to pick out the right shoe for yourself?
It's really important to know your feet. If you have a weak arch, it's important to have a more rigid shoe. If you have a high rigid arch, you look for a more flexible shoe. And it's very important to get the right length. Don't feel the toe at the end of the shoe. Our feet swell when we exercise, so you want to have a little toe room.
So maybe a little bit bigger. You don't want them to completely
If you're
snug.
usually a 9, you're going to be at least a 9.5.
Okay, fantastic.
Yeah.
Betsy, thank you so much
You're
for all
welcome.
the great advice on the products. We appreciate you joining us. Don't go anywhere. We are going to cover some of the health myths regarding running and treatment for injuries. That's going to come up in just a second with our athletic trainer. So don't get anywhere. We're going to take a quick break and we'll be right back.
Rebuild. Restore, recondition, rejuvenate. Florida Hospital Sports Medicine and Rehabilitation, getting you back to better. Rebuild, restore, recondition, rejuvenate. Florida Hospital Sports Medicine and Rehabilitation, getting you back to better.
All right, thanks so much. We're back with David Cassidy. He works here at Florida Hospital. He's going to talk to a little bit about some of the myths behind running and his expertise as an athletic trainer. We're going to tap into that. David, thank you so much for joining us.
Thank you for having me.
Absolutely. A lot of myths out there about running. So we want to cover some of the top ones, and I'm going to go through them one by one, and you tell me why they're totally false, because these are myths, right? Okay, myth number one, you can't run in the rain. Why not?
That is false. People say that you'll get a cold or you don't feel very good. Quite frankly, the air outside is cleaner than the air in the gym, right? So if you really want to get a cold, you probably stay in a small confined space. So just dress appropriately for the rain. It's actually probably better for you to run outside than it is inside.
It is to run inside. Okay. A few days off of training is going to hurt your progress. Is that true or false?
No, wrong. You can actually,
no
even if you're training at a very high level, you can take up to 5 days off, and it would not affect your training and your fitness level at all. So actually taking a day off actually helps you in your recuperative period, especially when you're training long distances. Those down days are actually important to rebuild some of the tissue that you're breaking down. So you're actually getting stronger if you take some breaks.
Okay, good. I run too slow to run for exercise. That sounds like an excuse that I would use.
Yeah, well, people are looking for excuses.
I know.
But
right?
the fact is that, the runner's world is very forgiving, and they're very inclusive. So they don't really care that you run slow. They just care that you're running, right? And as you see these races and all these people having fun, when the gun goes off, everybody takes off, right? And everybody finds their own pace. They usually have races, some of the bigger races that Betsy and Track Shack run, they actually stagger the people that say if you're a 7-minute mile or an 8-minute mile, so you can actually funnel your way into the perfect starting spot.
And so you talked a little bit before we started about walking and running too slow, and so many people don't even run through the entire race that they're going through. Some people mix it up. Talk about that.
No, actually that is probably the most popular training method right now. Some people that are elite runners and train for it will run an entire distance race, a 10K, a 5K, a half marathon, or a marathon, and they will run the entire 26 miles. There's a whole intermediate group of runners that are blending a walk-run type of regimen that they run for an increment of time, say 90 seconds, and they'll walk for 30 seconds, and they run for 90, and they find their interval that they're comfortable with, and they'll do an entire marathon by doing nothing but run-walk. It has become very, very popular. Women has embraced this type of running method, and the half marathons are actually more popular than marathons from a participation standpoint. So the fact remains is this training method is wildly successful and wildly popular.
Fantastic. Okay, not an excuse anymore, going
Not
too
anymore.
slow. All right. Kids, what about kids? I know some people want to get their kids involved in racing, but some people think kids should not run in races. Talk about that.
Yeah, I get this question a lot, whether it be running or when does a kid start in a weight room to start lifting weights? And they say that the old myth has been that you never start training rigorously until after the secondary growth spurt. And that is false. Quite frankly, we are starting to move kids into weight rooms because of earlier, and certainly running programs much earlier. It's not hard on the bodies. They're talking about problems with their growth plate. We're not seeing any of those things. People that have problems with their growth plates are actually trauma, kids that fall out of trees or unfortunately car accidents. It takes that type of velocity to create a growth plate problem. So running, as we were kids, we just ran everywhere. We ran around the neighborhoods, right? So if a kid, 7, 8 are running 3 or 4 times a week, they're fine. They're especially with the 5K races. It's 3 miles, and those kids are doing really well. So yes, they have to be training. They should be running three times a week. They should be out there doing a couple miles. But the fact remains is we're seeing no problem with that.
Running is good for kids too. Okay, and I'm too old to run.
Now that's an excuse. The fact is that we're seeing people run half marathons and marathons, the 5Ks and the 10Ks. We're seeing all ages, right? We're starting to see kids, and it is not uncommon for us to see a 70 or an 80-year-old.
Fantastic.
You know, I actually embraced running a little bit later on in my career, and the fact is that my first marathon was when I turned 50.
Wow.
So it was very fun. It was one of those little goals that I wanted to accomplish, and I crossed the finish line the day before my 50th birthday. So really, age isn't. It's the training. Really, what Betsy was saying is, if you're smart about your training, you get into it, you're adequately prepared. You know, the age is no longer a factor.
So if it's on your bucket list, don't be afraid to check it off.
Go grab it.
Okay, good. Let's talk about some of the common injuries that even veteran runners can get and succumb to. What are some of the most common injuries that people deal with when running?
Yeah, most of the time we're treating some of the itises, the tendinitises, the bursitis, plantar fasciitis. Betsy talked about shoe and shoe fit. The plantar fascia is a very thick tissue that holds up your arch. So she was talking about people that have high arches or some people that have flat feet. If the shoe isn't adequately supporting that tissue gets stressed, right? You create a small little irritation, you get some swelling, and now you're caught in this swelling, irritation. So that's a tendinitis or plantar fasciitis. It's a little bit challenging to treat, a little anti-inflammatory regimen, a little bit of maybe this little roller, a little soft tissue mobilization really does that pretty well. Some of the other ones would be shin splints. We've all heard about those achy shins that some runners experience. Well, that's a small little micro tear of where the muscle inserts into the bone. So we really have to make sure that tissue is soft and pliable. We have to warm up properly, we have to cool down properly, and we have to treat that area. So a little bit of mobilizations, a little warm up really does well along there. I see a lot of knee discomfort, and so knee discomfort is more in the lines of a patellofemoral syndrome or an irritation. The kneecap's supposed to sit in a little groove. Some people have a little wider hips, some people have narrow hips. Because of that configuration, the kneecap has a tendency to kind of glide sideways a little bit. And when it does, it bangs up against tissue. So that patella really needs to sit better in the groove. And actually we find that people that run and get stronger, the strength of the quadriceps actually helps the glide of the patella, where that's actually where we're trying to decrease that irritation. And Betsy talked about the IT band. We see an IT band syndrome. That's a friction syndrome where it's a very thick band that runs on the outside of the hip all the way below the knee. And soft tissue mobilizations, that roller really helps that. And because of the friction, running's repetitive. And because you can create a little hot spot or a friction area, that band kind of rolls over that same spot. So soft warm up, cool down, keeping that tissue soft and pliable really does help reduce some of those itises.
So what I hear you saying in almost every one of those situations that you described, it's the warm-up and the cool-down. It's the warm-up and the cool-down, and doing the things at the beginning, at the end, to make sure that you're taking care of yourself is going to help prevent a lot of those injuries.
Well, you're getting into running to try to really help yourself, right? For fitness or conditioning. So you really don't want to be injured. You're not getting out there to create those irritations. But the fact remains is being prepared, whether it be your equipment or yourself, is really the best course of action. So a proper warm-up, and that's usually where you want to be walking around or a slight little jog, right, until you break a sweat. A small little bead of sweat is actually what we consider a proper warm-up, because you don't sweat until your core temperature elevates 1 degree. Right? So as soon as you create a little core temperature, your body wants to start cooling you down, and that's where the sweat mechanism comes in. So you really want to start your training regimen right after you do a proper warm-up, right? So that's a little trick, a little tip that you should probably be starting to set between you set your miles and go for your training regimen. And then when you stop, everybody wants to just stop.
Yeah.
And you're really grateful that you're stopping. But that's actually another time where you want to really kind of slow down your heart rate and stretch the muscles back out. Because a healthy joint and a healthy group of muscles is one that has adequate strength and perfect range of motion. So when you're running, you're really kind of running in a small little arc, right? So you really want to get those muscles back out to their original length.
Fantastic. And obviously we don't want people to get injured through running, but it does happen. Talk about what kind of treatment you could seek if the injury is beyond the stretching, the pre and post race type of thing.
So some of the itises, they're incredibly uncomfortable, but you don't get a ton of pain with them. They're just uncomfortable. But when you start to get over the edge where you start to have some pain, well, now you're flirting with an injury, and you have to actually back down a little bit. So the same thing that we do with standard first aid, a little bit of ice, a little bit of rest, a little bit of compression, right? You may want to elevate it a slight little bit and see how that responds. Typically, your body will respond pretty well, usually the day off of rest. That usually helps things. But if it persists and you really can't get ahead of it, you may want to start to seek a medical provider.
Okay, fantastic. And tell us a little bit about who you work for at Florida Hospital Sports Medicine and Rehab, and what your folks do there.
Yeah, well, we're a physical therapy company. We're an outpatient physical therapy, so we actually help people get well, right? Get back up on their feet. We specialize in making people more active, whether it be after a total joint replacement or whether it be a high-level athlete. We want them back out on the court, or we want them back doing their normal daily activity. So that's typically what we do during the course of our day.
Cool. Fantastic.
Well,
David, thank you so much for spending the time. I want to thank Betsy and David for their expertise. And we got to wrap up today's Healthy 100 Health Chat. And of course, if you want to learn more about this topic, you can go to www.fhsportsmed.com. That's where the folks where David works, to learn some more about that. You can also find out more about upcoming web chats. If this was helpful for you and you like this topic, we'd love to hear about it. But if you like us at Florida Hospital's Facebook page or follow us on Twitter, we'll let you know when we have more chats like these coming up, so you can watch there. We're always updating what's coming up, what the topic is coming up. So thanks so much for watching today, and we certainly thanks for those who participated in today's chat, and we hope that you will join us again. Thanks so much.